Simultaneously or any image guided is the preferred initial biopsy technique. Active and counseling and support system for patients for after diagnosing carcinoma of breast is also important. These are my references. Thank you.
Thank you, ma'am.
Thank you, Dr. Rashwati, for the excellent talk. So, any questions from the audience?
Excellent talk, Dr. Rashwati. Just a query, fibroadenoma of the breast, is there any hard indication where you need to excise in a patient? Usually keep an observation, but sometimes we see surgeons do excise them. Is there any indication per se or any suspicious thing where you think it's safer to do an excision?
So fibroadenoma, usually the patient themselves comes to us that we have to get it removed. That is one thing. Second thing, the newer studies, fibroadenoma, the risk for later malignancy, we have been thinking it is very less. It is quite less. It is need not be removed. You can keep it follow. But some cytological variations in fibroadenoma, there are there. Some I had included, then I didn't include those things. There are cytological variations in fibroadenoma, like some atypical features, hyperplasia. Those things. Newer studies, there is a slight chance of turning into malignancy in the long run. Studies are still going on. But most of the time, the fibroadenoma, why we remove is, it is increasing in size. Young females increasing in size, they are worried. So smaller fibroadenomas, very small ones, ultrasound, we usually, if the patient is not very anxious and all, we keep under close follow-up. But the cytological thing is important.
On the other side, if there is a BIRATS 4, majority of the times we see they come with an FNAC, which is inconclusive.
Yes.
So what would be your next, and how many times would you just do a biopsy or would you go further?
Sir, if a breast patient with breast lump comes with an FNAC report inconclusive, first we think we look the age. Okay, of course, if suppose she is a 40-year above age lady, we will have an imaging, of course you must have had done an ultrasound. First we think the size of the breast. Size of the mass. If it is quite big and ultrasound is showing no proper BIRATS 4 lesion, A, B or C, let it be, C is more in favor, we can go for a true cut biopsy. But once the patient has already undergone an FNAC and it is inconclusive, being on the safer side, so that we don't have to repeat again, guided biopsy is preferred, so that you hit at the right point. Guided biopsy usually gives us, because I have shown the specificity is and sensitivity is more when you do a guided biopsy. So once he has already done an FNAC, it is always better to do a guided, even if the lump is big.
If it's a BIRATS 4B or 4C and you do a guided biopsy, it is again inconclusive. So would you suggest an excision or a repeat biopsy, or how would you follow?
We will go for excision. Yes. The better to go for excision.
In triple modality, which is your preferred option? Whether you think your clinical examination, mammography or biopsy, which is your final choice?
So I'll tell you, each has its own importance. One is not complete without the other. So clinical assessment is the one that guides you further, and imaging supports you, and biopsy is the final hit.
Okay, correct. What is, you have got a very false positivity. Mammography, you have got many false positive issues. Mammography, you have got a very false positive result. Mammography.
Okay.
False negative result.
Okay.
So if we can't relate the mammography, you've got to get some ideas regarding the, so your clinical examination is the most important.
Yes.
If your clinical is, it is a looking malignant, there is no need to join, you put a biopsy must. So don't, I mean, my experience, mammography reporting is very important. Who is reporting?
Yeah, who is
interpreting
reporting?
is very
Yes.
important.
Competency is very important.
Because again, again, belief is very important. Each part is important. So missing a breast cancer is a very, once they come into our clinic, then missing is very difficult.
Yes.
So it's happening. My clinical beds also have missed 3 cases.
Okay.
So it is common, it's not rare.
Yes, it's sure.
Breast cancer is very common. You need a close follow, close assessment. Repeat biopsy. Many times you need a FNAC, cut, or rarely going to extend biopsy.
Yes, sir. If something is inconclusive,
especially pregnant ladies, it's very difficult to get a, and lactating female is again very difficult.
very difficult, yes, sir. But mammogram has its own limitations.
Again, close follow-up is again important.
Important.
You can ask them, once you are suspecting, you can, your biopsy negative, you are thinking of again malignancy, ask them come after 6 weeks or 3 months.
Yes. And similar, I had a lactating lady, sir, actually. She has been sent from everywhere thinking that it is mastitis and milk, galactosine kind of picture. Young lady, she has come to me, and I also was biased because she was referred like that. But when further evaluation, the clinical suspicion was so strong, they gave an ultrasound normal. So then we further went and we took a guided biopsy, which has, because clinical suspicion was too high in that patient.
Again, patient is an important thing. They will, the period say something is there, the expansion may be normal.
Yeah,
If any patient saying that something is,
that is more tricky.
thank you. Then.
Thank you, sir. Thank you.
Thank you, Ashwati. Thank you.
That completes our first session. Now we move on to the formal inauguration of today. It is absolutely a privilege for us to host this continuing medical education session, Onco Talks, Basic Concepts in Oncology, organized by Dr. Rupans Medical College and Astor MIMS Cancer Institute. Welcoming all to today's function, may I request our beloved Deputy Medical Superintendent, Dr. Wasef Mayan, for the welcome address.
Good morning, respected dignitaries and my dear colleagues, dear friends, postgraduates and interns. So it's an auspicious occasion today. Basically, we have had a lot of conferences, brainstorming sessions on a few topics that we continue to learn on a daily, regular basis. But as far as oncology is concerned, it is generally regarded as one area where a common doctor is mostly ignorant. We generally don't respect oncology much, and if you see general practitioners, whenever we see something very skeptical or maybe something very confusing, we don't tend to evaluate further also. But as time has advanced, the evolution of how treatment and diagnosis of cancer has evolved is in path-breaking speed. So we have had a lot of advancements in the field of cancer, and generally what we see is, even if you look at academic side, even if we as a medical college, the amount of teaching that goes into oncology is very less. Like if you see general medicine topics, oncology is maybe like, if you take Davidson for example, oncology is a very small chapter. And evaluation in terms of oncology doesn't get the respect in an MBBS level, and that's probably one of the reasons why detailed evaluation of cancer is not something that was happening at a very good pace in the last century or so. But then it has evolved so much that now people have that understanding, and now people are beginning to accept that there are a lot of cancers that can be prevented and at the same time treated with excellent results. So it's a very good initiative from the Astor MIMS Calicut side to actually initiate a CME on oncology. And in fact, after 10 years of this institution coming into the fore, this is the first CME in oncology. So it's a very good and a very auspicious occasion today. And the task that has been conferred to me is to welcome each of the dignitaries and the participants for this CME. First and foremost, I would like to remember our chairman, who is the main visionary behind starting up and setting up a medical college in a remote village like Wayanad. So the amount of change that has happened to the health-seeking behavior of the predominant tribal population of Wayanad, the amount of change is not something that we can put into words. Because a lot of, even if we have had a few research done from our institution, Dr. Shanavas was somebody who took the lead in doing some investigation of oral cancers in the tribal population. And there are a lot of studies which says that even tribal population, that because of their poor health-seeking behavior, the incidence of cancer and the prevalence of cancer is very high. So first of all, I'd like to thank our chairman for making the initiative in starting this organization and helping us grow in the way that we have over the years. And next, I would like to welcome our Honorable Dean, Dr. Gopakumaran Katta sir, to this gathering. He is the captain of our ship, and he is somebody who insists that we need to pursue excellence at all states. Next, I would like to welcome our Vice Dean, Dr. A.P. Kamath sir, to the CME. He obviously comes from a military background, so he is somebody who is very apt for our medical college to head the academic side as our Vice Dean, because he ensures that discipline is never compromised at any level. And next, I would like to welcome our K.V. Gangadharan sir actually to our institution. He comes to our institution once and frequently to initiate that the beginning of our oncology department, the setting up and all this framework was laid by the efforts of Gangadharan sir. And frequently we also encounter with Dr. Arun, who comes once in a while, once in a fortnight to see that cancer patient screening and treatment goes in a beautiful way. So welcome sir to this gathering. I would also like to welcome Dr. Srilesh, Dr. Sadish sir and Dr. Sajid Babu for gracing this occasion. Welcome sirs.
Inauguration
Thank you, sir, for joining the CME. Next, I would like to welcome our Assistant General Manager of Administration, Dr. Shanavas of Operations. Because a lot of groundwork goes into organizing the CME, I would also like to welcome Dr. Nitin from our Department of Oncology to this gathering. A lot of groundwork obviously goes to organizing any CME. Because what we are seeing is the final end product, but then organizing a CME is not a simple task. You need to plan ahead and you need to do a lot of groundwork in that regard. And congratulations to the organizing team. We have an excellent CME today. Okay. And I would also like to welcome our Department of Medicine head of the department, Dr. Anish Bashir, as well as other dignitaries. And finally, I would like to welcome all the learners, the young and learners of all levels actually. I see a lot of professors who have joined the occasion. I see a lot of heads of various departments and the practicing physicians across the district. They have all come in good numbers to actually learn a lot from this session. So I would like to welcome all of you formally as a part of the member of this management for taking part in this CME, and wish you a happy learning. And we have already had a very few brainstorming sessions. All the sessions were excellent and hope to continue that in the upcoming sessions. Thank you.
Thank you, sir. For the auspicious lamp lighting ceremony, may I request respected Dean sir, Vice Dean sir, Dr. K.V. Gangadharan sir, Dr. Shanavas, Dr. Vasif Mayan, Dr. Arun, Dr. Nitin and oncology team from Amsterdam, Dr. Satish, Dr. Srilesh, Dr. Sajid Babu, Dr. Rahul, Dr. Shafi, Dr. Abdullah, Dr. Anish Bashir sir, Dr. Fahim, Dr. Abdul Malik on to the stage. Dr. Selam sir and Dr. Lily madam.
പ്രസന്റ് ചെയ്യുമ്പോൾ ഇങ്ങനെ വെച്ചാൽ മതിയല്ലേ നാളെ പ്രസന്റ് ചെയ്യുന്ന ആളെ കാണില്ല
Dr. Keshavan sir also on to the stage. to welcome our captain, Dr. Gobhagavan Venkarta sir, respected dean, for the inaugural address.
Good morning to one and all. I don't want to stretch it further because wonderful sessions are over, and the same level of discussion is awaited. So I don't want to stand between this academic feast. But anyway, just to complete the whole formality, we will be having a formal session like this as an official inauguration. So I was actually given a task to inaugurate such an excellent academic feast. Respected dignitaries, the learned speakers, and the enthusiastic aspirants who have come here and joined with us on a wonderful day to share some of the basic concepts about the diagnosis, management, and of course maybe a prevention of the basic malignancies of our population. And it's a very relevant and a very pertinent topic to be selected for this particular program. I congratulate all the like-minded persons who worked behind to make this particular program a great success. The reason may be, we know that we are actually located far away from the mainstream of general population of Kerala in a remote area like Wayanad. But we are actually among the top, maybe in the country, as far as the incidence of malignancy is concerned. Gangaras are all here. I don't want to go to the intricacy of the demographic profile or the distribution of malignancy and all. To my little knowledge, I know that we are actually in the atom bomb of malignancy, especially as the Wayanad population is concerned. 20% of us are, the population are in the tribal area. They are much more vulnerable and prone to many type of malignancies. Not take any part of your body. Our population or our tribal population is susceptible to get this. Oral cancers, lung cancers, breast cancers, because of the, as you've rightly mentioned about their poor health seeking awareness and their awareness about the facilities that are available and all. So it will be a spreading message from a pioneer institutes in Wayanad as far as a teaching standard or a teaching attitude is concerned. I think we should be there in the front role to lead this particular social responsibility. Now, one thing very sad, as far as I am concerned, as I head of the institution here, I am not seeing much of the participation from the young, vibrant interns who are actually going to be the Indian medical graduates who are coming and treating the poor and the most needy patients once they start practice. So, my dear organizers and who are responsible for such academic program, to make sure that there will be an adequate participation from most of the senior MBBS students also, maybe you can include final years, but now they are having a cultural program going on to get from that to this particular academic section may be a very difficult task or even next to impossible, I should say. But make sure that such academic sections are directly penetrating into them. They are really motivated and they should come and attend such sessions, because the two sessions that I have just, it was marvelous, and it may give a lot of information to the final years just beyond the conventional teaching program. These are all stimulus variations they will be liking to have. So don't deny the opportunity of our medical students to be a part of it, and interns also can be there, and postgraduates. I don't know how many postgraduates are being represented here, but we are having a bunch of them. I don't know how many are here, but here please take make sure that the postgraduates are attending this particular program, and some sort of surveillance you can do it from the department side. Once again, I congratulate the entire team behind it, and all eminent faculty members like Naran sir and other speakers are here. So let it be a fruitful session for all of us, and I'm so glad that it is getting live streamed through a channel to the other part of our globe where Aster actually made a footprint. So that is another area where I should explore, because recently I went to Dubai and I just visited all 5 major hospitals in the Aster group. I'm very sorry to say that many of the academic activities and the vibrant nature which is happening here, the ambience, academic ambience we have created over the last 2 years is not being known to many of the major doctors in Astro Group. They are so enthusiastic to be a part of it. So I think hereafter we can invite them in an online mode. So they are more than happy to be a part of this academic forum to contribute from their side and they are also being a good listening mode also. So try to exploit that also. So we will be having some sort of exposure. So being a teaching institution, we should come into the limelight. So once again, it's a wonderful session. With all your permission, the grace of Almighty and the nature, I officially declare that this particular academic feast is officially being inaugurated. Thank you once again, be a part of it.
Thank you, sir. We are honored to have among us the senior most oncologist and a pioneer in North Kerala in cancer care, currently working as the chief medical oncologist and head of the Department of Oncology and Stomachs. We are delighted to have you present, sir, Dr. Gangadharan, sir, and welcome you for a felicitation address.
A very good morning to our respected dignitaries, our deans, sir, and senior faculties in Medical College, teachers, and dear friends. Very happy today because we initiated our oncology department almost 6 years back. So at that time, we had put a small meetings and get to work here. That time, then one of our post DM MD residents joined. After 2 years, went to DM. Next day, one more joining again. After next year, he again shifted to as a DNB in medical oncology. Third, one more has joined again shifted to DM. We go to DM residency. So now we have got Nitin is here. He is very much actively interested in academics as well as in clinical practice. I think he's one of the best doctors I have seen. He's a very sincere, dedicated person in our department. I'm very happy because he is always behind this whole scenario. He is the person taking care of all CMD. He personally involved in our last 2 months. He has personally involved in each and every activities here. Again, then Dr. Arunan Malik has joined our department. Now again, we want to improve our department day by day. We want to improve because now the radiology part is improving, pathology part is improving, and our specialty is improving. So in future we can develop a full-fledged oncology here. That is our vision. And again, I'm MIMS, Calicut MIMS are also always helping and supporting to, and they are ready to support any extent to develop the oncology department here. Again, one more important thing is this topic we have chosen is a basic concept in oncology. Now also I'm thinking this is one of the important topic. Because to detect early or to work up properly, that's a very important part of medical education. Each clinician should know how to investigate, how to do a proper clinical examination. That's a very important basic things. Especially in oncology is a very important thing now. Because cancer is now very common disease. Everywhere, if you think of our geriatric population is increasing. Our incidence of malignancy is increasing. So we should stick on our basic clinical practice, examinations, and detect early cases. And all general practitioners should be involved in always think of a one possibility of malignancy, always. Because anything is not responding, not recurring, not relieving, always think of one possibility is a malignancy. Do proper workup. Again, workup means I think always prefer to go for tissue biopsy. If you do breast, lung, GIT, head and neck, everywhere, always think of a tissue biopsy. That is the only way to confirm our diagnosis. Again, oncology is now evolving as a very vast specialty, highly specialized specialty. We have got breast surgeons, we have got lymphoma clinicians, leukemia clinicians, transplant clinician, PMD clinician. It's a very highly specialized lung cancer clinician. So it is a very highly specialized field. So again, the thing is molecular biology, molecular pathology is evolving in such a vast area. Oncology is now shifted to a molecular oncology. Again, basic thing is now the same. How to do a proper examination, clinical assessment, workup. That is the only way to detect early cases. Thank you again to Open Medical College. There are many of our faculty members, many of our students as well as our Dr. Shanavas is very much involved in our CME program. So once again, thanks to all delegates as well as the person behind this CME. Once again, thank you all.
Thank you, sir. Thus, we conclude the formal inauguration session of today's CMI. Now we have the memento distribution for the speakers of the first session. May I request Dr. Anish Bashir sir to hand over the memento to Dr. Nitin Abraham. Thank you, sir. Requesting Dr. John C. Matthews, sir, to hand over the memento to Dr. Linisha. Thank you, sir. Requesting Hanumantappa, sir, to hand over the memento to Dr. Ashwini Kani. May I request Gunadharan sir to hand over the mementos to our chairpersons? Dr. Anish Bashir. Dr. John C. Matthew. Dr. Hanumantappa. Thank you, sir. The second session will be continued after a short tea break.
വീഡിയോ ഓഫാക്കിയാൽ കേട്ടോ പറ
വീഡിയോ പേയ്മെൻറ്റ്
പറ്റൂല സി വി ജി പോളോ